Hi, my name is Itsik Levi, and I'm the director of the HIV and the STDs clinic here at the hospital. And because it is December now, which is the awareness month of AIDS, HIV, I'm going to talk with you about this subject and really give you some important views. People are asking me a lot, what's the difference between being HIV positive or having AIDS? Well, being HIV positive, it means that you were infected with the virus. It doesn't say anything actually about your immune status right now. And AIDS means that your immune status is so low that you cannot combat normal diseases that other people will combat normally. What we want is that you will not be detected while you have AIDS, because a third of our patients, unfortunately, are being detected because of AIDS. And I wish, my dream is that everybody will be detected while he's HIV positive, so we can start treatment early and not let AIDS develop. The way of being detected early is just to go and do a blood test. And do it even if you feel okay, even if you don't think that you belong to a classical risk group. Because most people that are being detected late are those people who, due to stigma, are not considered to be in a risk group. Because, usually men having sex with men, they have awareness, they go and have tests, so we can detect them. But people who are heterosexual or elderly, they are not considered as having HIV, and mostly they are those detected late. Nowadays, we have a combo test, which is the new generation of tests, and it's enough to wait 7 weeks from the exposure until the test. So you can get the results within several hours. Nowadays, I think that most people know that they can live normal life, the same longevity as everybody else who is HIV negative, with a very good quality of life, and that's because of the advancement in the therapies that we have today. Some say that it's easier to treat HIV now than hypertension, diabetes, or the other regular disease that people know better. I still think the best thing is not to get infected at all. But if you get infected with HIV, it's very important to get detected early. A few years ago, there were some studies, we call them the partner studies, which showed that if you are getting a treatment and you become undetectable, you cannot transmit the virus, which means that if you're undetectable, the virus is untransmissible. And the CDC calls it U equals U. And it brings two important things. First, biologically, you'll stay healthy, you will not infect other people. And B, the second thing is that if you cannot transmit it to other people, then all this emotional burden that was on people is really reduced. And all the stigma surrounding HIV is much less. Prevention of HIV actually has 3 legs. One leg is treatment as prevention. If you'll be diagnosed early and you'll be treated, you cannot transmit it to other people. So I really urge people to go and be tested. And if you are in some risk, go and be tested once yearly, at least. The other thing is PrEP, pre-exposure prophylaxis. If you really belong to a risky group, or your risk is higher than the average, you can get now a pill once daily, or even injections 1-2 months or once every 6 months if you live abroad, and you can prevent the transmission of HIV by 96-97%. And the third one is PEP, post-exposure prophylaxis. If you did everything that you were taught to do, like using a condom, etc., but something happens, and things happen. If you run, you fall. If you have sex, sometimes things happen. Then you can go and start preventive therapy. And if you will do it as close to the exposure as possible, then again, it's about 90% that you can prevent the transmission.